Good morning, everyone. We'll start today's press briefing with Mayor John Cooper, followed by Dr. Michael Caldwell, Director of the Metro Public Health Department. We will also hear today from Hank Hilton, Executive Vice President of Stakeholder Relations for Pathway Lending, and Angela Crane Jones, CEO of the Nashville Business Incubation Center. Joining us this morning to help answer your questions are Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Chief John Drake from the Metro Nashville Police Department. I'll begin with Mayor John Cooper.
Thank you. Good morning, Nashville. I want to start this morning with some new information about COVID in Nashville. Our key metrics are not going in the right direction. Now, this is a challenge, but I know we are up to it. But here's what we know right now. Our transmission rate is in the red, the highest since the 1st of July, and our new cases per 100,000 is the highest since late August, and we are seeing more COVID patients in our area hospitals. Many of those patients are not from Nashville, but from surrounding areas. But we're seeing a similar pattern across our state and many parts of our country. New cases and hospitalizations are going up. And take a look at this chart behind me. The yellow line in each of the four graphs shows Davidson County's COVID-19 progress since beginning in March 1st. The top left is Shelby County's progress, which you can see in blue. Now, Shelby County took similar steps as Nashville, requiring masks and limiting gatherings. And Shelby has a similar curve of new cases to Davidson County that you see Davidson in the yellow. This strategy has allowed cities like Nashville and Memphis to control the virus instead of letting the virus control us. And as a result, we are trending better than the rural areas. Now, in the other three graphs, you can see how Davidson County compares to three Middle Tennessee counties, Pickett, Clay, and Houston, that happen to be in the top 5 Tennessee counties by coronavirus spread. Their experiences with COVID-19 are indicated by red lines. These counties took different paths with fewer restrictions, and now the virus is spreading there much faster compared to Nashville, despite our density, which makes it much easier for the virus to spread here. This is a pivotal moment, but we've been here before, and we know things change quickly. Back early in the summer, our metrics were also going in the wrong direction. Our daily cases jumped from 200 to 400 in just a couple of weeks. This time can be different. And again, we know how to flatten the curve, and we know what works. But we've got to take care of our families and our neighbors, and we need to keep up our guard. Masks work, social distancing works, washing your hands works. It will protect our community. It will protect our economy, and it will allow us to continue on phase 3. The virus is still around. It's not going away, at least for a while. Our job is to keep everyone in Nashville safe as we live with the virus. Now, businesses are taking steps to keep their customers and employees safe. Medical experts have told us how we can be safe. And it comes down to you, to everyone in our community. We need to do what works. We are all working to take care of our families and friends and keep them safe. So wear masks, keep your distance, and get tested if you are concerned. Earlier this week, I formed an advisory committee on hospitality, community leaders who will share their experience on operating businesses during this pandemic. They will consult with Metro Public Health and me on how to keep Nashville moving on our reopening plan. And I want to thank Barrett Hobbs, chairman of the Downtown Merchants Association, for leading this group, and all the others who are on this committee. Providing insights and firsthand knowledge will be a valuable asset as we move forward. And last week, Metro Council approved our plan for CARES Act funding for small businesses and live music venues. $2 million will go directly to small businesses and another $2 million to go to live music venues. Pathway Lending is our partner to administer these grants, and today Hank Hilton, Executive Vice President of Stakeholder Relations at Pathway Lending, is here to tell us more about the timeline and how businesses can apply. In addition, we have designated $1.5 million of CARES Act funds for programs to support small businesses. These programs will be managed by the Nashville Entrepreneur Center, Connexion Americas, and the Nashville Area Chamber of Commerce, and the Nashville Business Incubation Center. Angela Crane Jones, CEO of the Nashville Business Incubation Center, is also with us today to share more information about these very important programs. As we navigate this pandemic, we will continue to support our businesses in every way we can. And I urge business owners to get more information and take advantage of these resources. And now for some important reminders for all of us. Early voting began yesterday and will continue through October the 29th. Extra precautions are in place this year for safety. So if you haven't yet, please vote. Either now or on Election Day, have your voice heard. I'm grateful to the Davidson County Election Commission for their commitment to providing every eligible Nashvillian an opportunity to safely exercise their constitutional right to vote. Also, please get a flu shot. You've heard it from our medical experts, and now you're hearing it from me. This year, it's important to get the flu shot so we don't have a big outbreak on top of the pandemic. And finally, this week, I'd like to salute Devin Graham, our Community Hero of the Week. Devin is a person who runs towards disasters, so it was no surprise she was one of our first volunteers at Nissan Stadium Community Assessment Center. She has been there, welcoming patients, guiding them through rain, heat, and cold. I salute Devin and all the heroes working at the community assessment centers. You answered the call to serve when your city needed it most. Thank you. And now I would like to turn it over to Dr. Michael Caldwell, Director of Public Health here in Metro, who has more information on our metrics.
Thank you, Mayor, and good morning. Here's the latest on the coronavirus in Davidson County. We now have 31,011 cases. That's 54 new cases since yesterday. 1,443 cases are active. Our rolling day, 14-day average of new cases is 131.9, compared to 105.2 last Thursday. Our new cases per 100,000 residents in this morning is 22.47. This is compared to the 15.5 new cases per 100,000 residents from a week ago. The transmission rate has increased to 1.17. Ideally, we need it to be at 1 or lower. I will address factors that have led to the case increases later in my comments. There are 178 patients in Nashville hospitals with COVID-19. This is up from 125 last week, but still below our peak of 222 in July. Since October 1st, 43% of those visiting emergency rooms at Nashville hospitals are from outside of Davidson County. Our hospital bed capacity is 14%, and the ICU capacity is 10%. As we've explained, these hospital numbers fluctuate even in normal times. 286 Nashvillians have died as a result of COVID-19. The mortality rate is at 0.92%. This is the rate that includes all ages. We continue to see that this virus impacts the elderly and those with underlying health conditions the most. This hasn't changed since the beginning of the epidemic and is true across the country. But please remember, 40% of the population has an underlying health condition. Our 7-day positivity rate is at 4.6%. Our community assessment centers are open today and every day, Monday to Friday, 8 a.m. to 2 p.m. Tests are free, and you get the results back within a couple of days. So if you have symptoms, have been in contact with someone who has the virus, or just have concerns, please get tested. The numbers that I shared earlier clearly show we have seen COVID cases counts increasing. Now, if you look at the graph behind me, showing late June and early July, you'll see it took just 16 days for our cases to more than double. You'll also see that we are back at the same starting point based on today's cases. There were weeks where the number of new cases were below 100. The increase shows this pandemic is far from over, and we need everyone to refocus our efforts to keep from repeating what happened back in June and July. That means we all need to choose to enter the community safely, wear a mask, stay socially distant, and get tested if you feel a need for a test. The reason for the increase is due to community spread. Our Metro Public Health Department's epidemiology team has identified several factors that are likely driving the current case counts and metrics, including overall testing numbers, COVID among school-aged children and their families, social activities. Testing numbers are currently higher across the county when compared to August. A large driving force is Vanderbilt's ongoing routine testing regimen among university students. This accounts for over 20% of tests in September, and through October 6th, had accounted for about 20% of testing in the county, all for October. The attack rate among Vanderbilt University community is lower than the rest of the county. We have found that residents in some zip codes continue to get tested less than others, and true cases are possibly higher than we know, as with any infectious disease. Since the beginning of September, we have seen an increase in cases among school-aged children and their families. Case rates among children between the ages of 0 and 17 years old have increased by 93%. Case rates among those 35 to 44 years of age have increased by 27.3%. Case rates among those 45 to 54 years of age have increased by 32.5%. These increases perhaps represent an increase among school children and their parents and families. We have several new clusters involving schools and university, primarily sports teams and weekend activities like classmates, parties, bonfires, sleepovers. Most infections among school-age students and school staff do not appear at this time to be driven by in-class transmission, but rather extracurricular activities and social gatherings. Since August 31st, we've identified 36 clusters, 17 of which were social activities in a school or university setting, including school sports teams, social gatherings, religious settings, or bars and restaurants. Some specific examples include at least 12 cases at a local karaoke bar, 10 confirmed cases at a religious service. These were not cases associated with this past Sunday's activity. 13 confirmed cases at a 7th grade party among private school students, a large volleyball tournament that resulted in 32 confirmed infections among student athletes and staff who reside in Nashville. Additionally, new clusters identified this week include confirming 4 cases associated with a wedding on September 26th, 4 cases associated with a wedding on October 3rd, and 5 cases associated with religious events. These cases were not from Sunday's event. Case interviews are resulting in longer lists of places attended during exposure periods, indicating that people are getting out and doing more in public settings. Everyone remembers in early June when cases rose from 200 a day to 500 a day in just 16 days. Cases peaked in early July when there were 628 cases in one day. It was at that time we took steps as a community to slow the spread of COVID, including implementing a mask mandate. I'm grateful that our community responded when we were faced with the spike during the summer, and I know, with your help, that we can crush the current increase. We need you to refocus on what we know works in our community and responded when we were faced with the spike during the summer, and I know with your help that we can really crush this current increase. We need you to refocus on what has worked before. So when you go out, please make a plan. Do it responsibly. Choose to be safe, and remember, when you wear a mask, your face mask, make sure you remember you're protecting those around you. When you wear your mask, make sure it fits properly, covering both your nose and your mouth, and remember social distancing whenever you are around others. Wash your hands and use hand sanitizer frequently. And if you think you need it, get tested. Thank you. We can do this, Nashville. Please keep up your vigilance. Now it is my pleasure to introduce Hank Hilton.
Thank you, Dr. Caldwell, and thank you, Mayor. Very much appreciated. And on behalf of Pathway Lending and our community partners that are involved in this initiative, the Nashville Business Incubator, we'll hear from Angela here in a minute, Conexión Americas, the Nashville Chamber of Commerce, and then our good friends at the Entrepreneur Center. We are very, very appreciative of the opportunity to be involved in this initiative and appreciate the response of the Mayor and Metro Council in providing these necessary resources and vital resources in response to the pandemic that's affecting all of our small business community. So as the Mayor mentioned, Pathway Lending is administering a $4 million pool of funds coming from the CARES Act monies that Metro received. Those are to eligible small businesses in all of Davidson County. $2 million of that is dedicated to help small and micro-sized businesses cover operating expenses. 30% of that $2 million is specifically dedicated to our minority business community. So businesses with gross receipts between $35,000 and $250,000 are eligible to receive $5,000 grants. Businesses with gross receipts over $250,000 but less than $1 million up to $1 million are eligible to receive $10,000 grants. And those funds can be used for any normal course of operating expenses as well as anything related to COVID-19, PPE, or anything related to those matters in regards to the pandemic. The additional $2 million, as the Mayor mentioned, is dedicated to live music venues throughout Davidson County. Again, this is an assistance that covers up to 2 months of operating expenses. It does exclude payroll. Grants are available for up to $100,000 per business, per live music venue. And then to be eligible, recipients must have between 12 months gross receipts between February 29th, 2019 and February 29th of 2020, not to exceed $5 million. So we're very excited about being able to bring these two products to market with a specific emphasis on minority business community as well as on the live music venue community. So funds in both pools are available on a first-come, first-served basis. We announced and applications went live yesterday morning at 10 a.m. The response has been extremely strong. I would encourage anyone that is interested to apply as early as possible. We do have a limited number of resources, and we're going to try to deploy those as quickly as we possibly can because the need is so great and so is the demand. We do have until November 15th to deploy the funds. It is our anticipation that that will happen before then. So anyone that is interested in moving forward with an application or for more information about this program or any other programs offered by our community partners, please visit Pathway Lending's website at pathwaylending.org. There are links that will connect you to not only the application, but also to a really robust guide that will help guide you through that application, as well as updated daily, frequently asked questions and answers that we're getting from the community as to how to apply and what the funds are eligible to use. They'll also provide you with links to our other community partners and the resources that they're providing as well. So we really appreciate the opportunity to be involved with this. These are vital resources that the Mayor and Council are bringing to the small business community in Nashville, and we're super excited about the opportunity to be able to partner with our other community organizations and really hopefully have an impact on what the great need is in our community. So I'd like to introduce Angela Crane-Jones. Angela is the CEO of the National Business Incubator and is one of our community partners in this initiative. And Angela is going to talk to you a little bit about the opportunities opportunities that are available outside of funding, with a real focus on what we're calling the technical assistance or advisory services piece that the other community partners are bringing to this initiative. So thank you very much, and much appreciative. Thank you. Angela?
Good morning. Thanks, Hank, for the intro, and Mayor Cooper for the invite. I'm thankful for the funding that Nashville Business Incubation Center has received from the mayor's office. We have been awarded $600,000. These funds are part of the CARES Act, and these fundings will be administered according to the Metro Council resolution that was recommended also by the COVID-19 Financial Oversight Committee to provide financial support for small businesses. As one of the 5 organizations to receive funding, NBIC will provide business development and sustainability services to small businesses in the Davidson County community that have been affected by COVID-19. We will host workshops for restaurant reentry because, as we know, the hospitality and restaurants were hit the hardest. In those workshops, we'll talk through strategy, protocol, and diversifying revenue. We will provide free QuickBooks setup or assessment of their accounting system to help with a new revenue model that may be needed, as well as a lot of restaurants or small businesses don't have websites. We will be able to provide free websites with the funding, and if you already have a website, we will be able to help you get touchless pay with e-commerce capabilities, or help you just create a digital strategy. It is important to me at the Nashville Business Incubation Center to provide the education that small business owners need to learn, especially during this downturn. We want to ensure that you fortify your business so that you not only survive this, but you put systems in place to mitigate disruption in the future. Mayor Cooper wants to help you carry the load during this time. Micro and small business owners are short on money, resources, and time. So with this funding provided by the mayor's office, we can step in at NBIC and help you do some of the technical things that need to be done within your small business, like helping you build new websites for free, and then help you be able to better compete in this market. We'll be providing accounting services that, again, will help you manage the day-to-day budgeting, as well as create the financial statements that you would need to seek to get funding, or being able to go to pathway lending in the future as well. This pandemic caught all of us off guard, exposing vulnerabilities within businesses. Our programming and technical assistance is here to help you fill the gaps, and we're honored to be a part of the funding as well as the solution. We're grateful for Mayor Cooper and the Metro Council for their stewardship of these funds to small business owners. If you need assistance, please visit us at www.nbiconline.com. That's www.nbiconline.com. Thank you.
Thank you, Angela. We'll start our questions today. First up is Kathleen Seary with Fox 17. Go ahead, Kathleen.
Good morning. Thank you so much for taking our questions. So, given the way our numbers are trending, the transmission rate being in the red as we heard earlier, are we at risk of scaling back from phase 3, or will the city be making any other changes regarding business capacity or guidelines because of these numbers? Thank you.
Thank you, Kathleen. Dr. Caldwell, or the mayor.
Well, thank you, Kathleen, and Fox for the question. We know what to do. Wear masks, social distancing. It is so proven to be effective. Look at the graphs. This is a strong reminder today that we are at a moment of risk. We can do it. We can do it together. It is proven what works, and let's just follow that science. And again, we're going to have the disease for a period of time. Our job is to set a normal of getting back to work while staying safe. And our experience in the last 2 months proves that we can do it. Memphis has done it. Basic courtesy of wearing a mask is important. It's not only keeping you and your family safe, it is keeping our economy safe too. But great question, and we need your viewers to understand the importance of this moment in Nashville of keeping everybody safe. And if we do the work of getting this done, we will control the virus as opposed to the virus controlling us. Thanks.
Next question is from Julia Palazzo from News 2. Go ahead, Julia.
Hi, Brian. Thank you so much. If I could ask Chief Drake 2 questions about the large worship gathering over the weekend. We aired several 911 calls of people calling about the event and being concerned about it. Could you talk about the police response to that and if enough was done to break it up? And similar to the Fashion House party, the 2 hosts of that issued arrest warrants. Is it possible that the host or hosts of this event will be issued arrest warrants as well? And Dr. Caldwell, the clusters related to school-age sports teams and events you mentioned, will the health department re-examine the policies and protocols in response to this? And for social gatherings you mentioned, I know it's probably more difficult to monitor those, but will enforcement protocols have to change to help keep a closer eye on those gatherings? Thank you.
Thank you for your question. And just to say, I'm very disappointed in the organizer and the people that were at Sunday's event for not prioritizing their public health. We had no advance communication from the organizers. We were aware of a Facebook post, and part of our enforcement group, we tried to make contact without success. I am aware of 3 phone calls, not 9/11. We had an on-duty sergeant that drove by, and he looked at the event and seen that it wasn't disorderly and that they weren't about to march on the street. And so he made the decision not to notify any of the command staff. And so it's really about what we're going to do moving forward. And I had a very pointed conversation with our leadership earlier this week to ensure that notifications are always made. And if we do have a police response, what would that look like? And at a very minimum, we could have issued masks, we could have given warnings, and we could have asked people to social distance. And so it's all about moving forward and what we're going to do, and we have a plan in place moving forward. As far as looking for warrants, that part of the investigation will be by the health department, and Mr. Hugh Atkins will address that part of it.
Thank you. Yes, we are continuing to reach out. We have some contacts that organizers locally that we are reaching out to get as much information as we can. And after we speak and see what we find out, we can make decisions on what we might do as far as citations are concerned. But as Chief Drake emphasized, we want to look forward. It's important. The current order requires people that want to have a gathering over 25 people to submit an application through Metro Public Health Department. And part of that application process is to tell us how you plan to manage your crowd and how you plan to manage social distancing and folks wearing masks, and that you have people provided to monitor that at the gathering. And the process of going through and getting an application approved is a learning process, and it gives the health department the opportunity to consult with these organizers and have events as safely as they possibly can. So yeah, this was a disappointing event in many ways that so many people did not have a healthy respect for their fellow citizens to be crowded in like that, and not really a healthy respect for the status of the virus still being spread in our community. So we need to take those things into consideration. But if you want to have a gathering, please go to the website and submit an application and get some consultation from the Metro Public Health Department before going forward. Thank you.
Good morning, Julia. As for the clusters, school-age sports teams, any time that we identify clusters of cases is almost too late. It does give us information, and we're going to continue to monitor that to adjust how we approach where these clusters are. But I'd like us all to focus on clusters of risk factors. You've heard me talk before about the fearsome four. Fearsome four are 4 categories of risks that provide the most risk of COVID spread, and that would be indoor, no face mask, no social distancing, and alcohol. So as we look across the community, we're not only monitoring cases of COVID, but where we are seeing clusters of these risk factors, and we're trying to mitigate and minimize those as much. We could see those risk factors immediately and doing our best to reduce them. So I was at the Nissan Stadium for the first in-attendance game of the Titans, and we now were able to have a crowd there with a reduction of those risk factors. It was outdoor. It was 99% plus of face mask compliance. Social distancing was excellent in the seating area and throughout the concourse, and very limited alcohol sales. So there's a good example of how we're continuing to monitor, not just for the cases, but the clusters of risk factors. Thank you, Julia.
Thank you. Our next question is from Brett Kelman from the Tennessean. Good morning, Brett.
Good morning, everyone. I would like to revisit the very first question that was asked because I don't think we got a concrete answer to it. Is the city considering moving backwards in its business restrictions, tightening any of the rules for bars or restaurants or gathering sizes, any of the rules that we have slowly taken away over the last couple of months? Are any of those on the possibility of coming back because of what we're seeing in the city right now?
Thank you. This is John. No. We had 54 cases today. 54 cases today. That's below 10 per 100,000. Now we need this to be a streak. We need people to pay attention. This is a reminder today how important this is and why we have to get out there and socially distance and wear masks. We have to serve our whole economy too. We are up to it with technique and respect for each other in not having another outbreak. But we have a lot of personal responsibility to get that done for all of us. But in the overall look of, concern, we're at 54 today. Super good number. Let's stay at it. We can do this, Nashville.
Our next question is from Rachel Wagner with the Tennessean. Rachel.
Hi, thank you. Can you hear me okay? Okay. So my main question is, circling back to the gathering on Sunday, what needs to happen next if there are going to be charges or citations brought based on what we were just told?
Thank you. Yes, again, we are contacting people that we know that were associated with the event. There was a local person that contacted us, actually, to let us know that he was involved. He is providing some information. We're trying to get more from him. But also, it's important to know that the main participant in this event was from out of town. He came in, and a lot of the crowd, we're finding out, followed him in here. The local organizer was also surprised, I think, that the crowd was as big as it was. So as far as citations, it's just going to depend on what we find out in our ongoing investigation and if we can find people that are responsible to issue citations for. And that is an ongoing effort between the Metro Public Health Department, Metro Nashville Police Department, and the Metro Department of Law. And all we can say at this point is the investigation is continuing, and we have somebody that is cooperating with us who was a local event organizer. Thank you.
Thank you. Our next question comes from Stacy Case from Fox 17.
Thank you, Brian. Obviously, we've learned a lot as we've gone along through this, but on further review of the closure of bars and restaurants this summer shows that 13 of the 19 cases comprised in what was called a cluster at the beginning of July were actually at twin bars in Midtown and not on Broadway. And iconic Broadway bars feel like they were publicly labeled super spreaders erroneously. You know this. In hindsight, if given the same circumstances today, would the city handle this the same way, given what we've learned? In other words, should we manage these clusters where they are actually occurring rather than painting everyone in a particular industry with a broad brush?
Yeah, Stacy, this goes back to my comments earlier that we don't just look at clusters of cases, we look at clusters of risk factors. And remember that fearsome four: indoor, no face mask, no social distancing, alcohol. That's where COVID loves to spread. Now, unfortunately, in restaurants and bars, people have their face masks off a lot because they're eating and drinking. I'd like to see more efforts and partnerships with our colleagues in the hospitality industry to see how can we get people to wear their face masks more throughout their dining and drinking experience, if possible. So we are not going to change how we look at trying to reduce places where we see those clusters of risk factors. Thank you.
Our last question comes from Nancy Amons with Channel 4. Good morning, Nancy.
Good morning. Thank you, Brian. I have some questions about the Sunday event again for the chief, if I could follow up, please. He mentioned there was a Facebook post about this event, and also that an on-duty sergeant went by, saw it was not disorderly, and decided not to notify command staff. Can he address how big the event was at that time, about what time that was? And also for Hugh Atkins, he mentioned that a bunch of the people apparently had followed the leader of this organization from somewhere else, that they were from out of town. Can he elaborate on that, please? Thank you.
Thank you.
Nancy, thank you for your question. We didn't have any advanced communication with the organizer. We did have the Facebook post. Our Threat Assessment Center looked at it and assessed that it was going to be no larger than 200 people. And we have events all the time in downtown Nashville and throughout the city, almost daily. And so when the calls came in, the sergeant made the decision that it wasn't disorderly, it wasn't going out onto the street, and it wasn't a chance of vandalism. In hindsight, what should have been done was notifications should have been made to the command staff. And had I been notified, we would have made the proper decision, one of social distancing, two, to wear a mask and to educate. And I think that would have helped us tremendously just by having notifications. We had a very pointed conversation. I believe moving forward, we'll have a better plan for any incidents like this in the future.
Yes, thank you. As to a large portion of the crowd being from out of town, I think you can look at some of the social media posts and determine that a lot of the people were from out of town. Also, this one performer that showed up is from California and has been promoting these events all across the country, and the local person that we spoke with indicated that people followed him he was in Atlanta the previous day and had been, I think, in South Carolina or somewhere else immediately before that. So some of these people apparently are following him from place to place when he gets into a certain region, and that's what that was based on what we've seen on social media and what we learned from talking to the local organizer. Thank you.
Thank you. Those are all the questions we have this morning. I'd like to thank Hank Hilton and Angela Crane-Jones for joining us today. As always, we're grateful to Amy Lankheit and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these briefings. The next Metro COVID-19 press briefing will air on Thursday, October 22nd at 9:30 a.m. Thank you for joining us. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more